Hi, everyone. Welcome to OHEA's 2023 Political Education Series. The event is titled Not a Problem to be Solved, or no es un problema a resolver. Today's event is focused on disability justice and COVID-19. We're so grateful and happy that you're here with us today. We're going to go through these slides briefly. Before we start, we're gonna do a Zoom tutorial and overview. So for interpretation, click the language you would like to hear, and you'll be able to hear the stream from the interpreter that you choose the language. And for panelists too, please choose the language so it can be appropriately interpreted. You can also change to gallery view so you can see the speakers and interpreters. And then there is a Q&A option below where you can submit any questions throughout the panel, and then we'll have an actual Q&A at the end of in the last 20 minutes. Okay, so before we start, I'd like to give a land and labor acknowledgement. Every community owes its existence and strength to generations of ancestors who contributed to our hopes, dreams, and collective possibilities. Together, their history allows us to leave our own legacy of hope and justice. Our collective history is that of cultural resilience, re-indigenization, adaptability, colonization, settlement, systemic violence, racism, and forced displacement. Acknowledging this truth helps build mutual respect and connection across diverse communities and lived experiences. Land acknowledgement. We start by acknowledging the land on which OHEA, or the Oregon Health Equity Alliance, is situated, and which we occupy tonight. What we know as the Portland metro area rests on traditional village sites of the Multnomah, Wasco, Cowlitz, Calumet, I apologize, Cathlamet, Clackamas, Band of Chinook, Tualatin, Kalapuya, Molalla, and many other tribes who have made their homes along the Columbia River, creating communities and summer encampments to harvest and use the plentiful natural resources of the area. We are on this land because of the forced removal of its traditional peoples by white colonists and settlers. We recognize that the rights of Native and Indigenous people and nations have been and continue to be denied and violated. We want to thank the original caretakers of this land and their descendants who are still here. In addition to our thanks, we encourage folks to take action in supporting Native and Indigenous communities, such as learning about the Indigenous people of the land they occupy, honoring treaty right obligations, creating deeper relationships, and supporting land back initiatives to Native communities. And this was adapted from Forward Together. And a labor acknowledgement. We must acknowledge that much of what we know of this country today, including its culture, economic growth, and development throughout history and across time, has been made possible by the forced labor of enslaved Africans and their descendants who suffered the horror of the transatlantic trafficking of their people, chattel slavery, Jim Crow, and repressive laws, including the Black exclusion laws in Oregon, that continue to impact Black folks today. We are indebted to their labor and their sacrifice. Moreover, we must acknowledge and address the tremors and legacy of that violence throughout the generations and the resulting impact that can still be felt and witnessed today in our region and beyond. So who is OHEA? OHEA, which stands for the Oregon Health Equity Alliance, is a people of color-led collaborative organized to center and uplift the wisdom of our communities of color through racial justice-informed health equity policies and practices as part of the movement to dismantle white supremacy and shift the imbalance of power. Our vision is that we envision a world where people of color are able to lead fulfilling and healthy lives however they choose. And our bodies of work include advocacy, convener, and knowledge center. So this is an agenda. The panel will start after the intros, or after this section. We'll have a break at 7 for 10 minutes, and then we'll have a Q&A from 7:10 to 7:25. I apologize, the 15-minute Q&A, then we'll wrap up. Please remember to use the chat box or the question function to let us know what your questions are. Please say your name before speaking so we know who you are, and this session will be recorded. And also take care of yourself. So before I introduce the panelists, I just want to quickly introduce myself. My name is Esther Kim. My pronouns are they, them, and I'm one of the co-directors of OHEA. My focus is on policy and advocacy work, and tonight I'm joined by my team. And let's start with panelist introductions. So I'm just going to call on folks. Rue, would you mind starting?
Can y'all hear me now?
Yes.
Excellent. Hi, my name is Rue Hale. I use they, them pronouns, and I have not prepared an introduction for today because access check-in, I am on the very edge of a migraine. So I may like pause a little longer to gather my thoughts. I may shift around a little bit to address the pain that's in my body. So first and foremost.
Thank you.
A little bit about me. I'm an organizer and activist about town. I have served so many different roles in community. Currently, I am the co-director of OHEA Art Gallery and one of Portland's creative laureates. I do a lot of disability organizing and social justice organizing, and I'm really excited to be here today. And I will pass it on to Joni.
Oh, I'm sorry. Can you hear me okay?
Yeah, we can hear you.
I didn't realize that my camera was not on. Hi, everybody. I'm really honored to be here, especially having the opportunity to be here with my co-panelists and hosts. OHEA does really amazing work for all of us, and I'm really grateful to know and work with them. My name is Joni Money Tang, and my pronouns are they, she. For a visual description, I'm an Asian person with light olive skin, shaved sides, and long black hair that's tied off to the side. I'm wearing large dark orange tinted glasses and a black top and a blue and white bandana type scarf. I'm a queer, disabled, non-binary, multiply neurodivergent patient advocate, community organizer, and health equity strategist. I live with severe and limiting disabilities. My work is informed by the intersection of racial equity, disability justice, and LGBTQ rights. I'm a first-generation immigrant and a first-generation college graduate. I'm a fellow of the Asian Pacific Islander Community Leadership Institute and a graduate of Unite Oregon's Pan-Immigrant Leadership and Organizing Training Program. And my experience spans disciplines which include academic research, medicine, public health, education, and social work. And in the last number of years, I've been serving or have served on the Multnomah County Public Health Advisory Board, Healthy Columbia Willamette Collaborative Community Action Team, which is how I got to know and work with OHEA, Metro Parks and Nature Equity Advisory Committee, Disability Rights, Oregon's COVID-19 Task Force, and Oregon Health Authority's Resource Allocation Advisory Committee. I also co-admin some groups that center around disability justice, and I've co-founded 2 equity-centered neighborhood groups. And I will pass it on to, I actually can't see everybody on my screen. Gabriel?
Yeah. Let's pass it to Gabriel and then we'll go to Patch.
Okay, thank you. Hola a todos. My name is Gabriel Sanemeterio, and I am the co-founder of Strategies for High Impact and Long COVID Justice. I want to thank the organizers of this event for having me, and I'm really grateful to be featured along such great panelists who are doing such good work. I'm speaking extra slow because, I mean, I'm a person living with HIV, myalgic encephalomyelitis, fibromyalgia, and other chronic conditions. So my conditions do impair me cognitively. So in part, it takes me sometimes a little bit to think, time to think. And also I know that it's better for the interpreters to speak slower. So I'm making an effort to slow down and let things take the time they take. But I know we started a little late, so let's go to Patch.
Thank you, and hello. My name is M. Patrick Monasteros, or Melanie Mel Patrick Monasteros, and I use they, them pronouns. I like going by Patch. I am calling in from Treaty 1 territory in Winnipeg, Manitoba, Canada, which is the original lands of the Anishinaabe and the Inuak, Anishinaabe, Dakota, and Dene people. And it's the homeland of the Métis Nation. I can put that in the, if I was too fast to enter, but I can put that in the chat in a second. I am an artist and writer, facilitator. I make a lot of work about bodies and illness and grief and talk to people about access and things. Access, I might have to lie down at some point because I am like, there's a fatigue happening in my life right now that's very encompassing. And I usually forget what I'm talking about. And so I might like need a prompt if I start a sentence and forget. And if I think of other things, that's I will bring that up. But yeah, I am a Black non-binary person, agender person with purple glasses and a lime green, what do they call it in the States? Beanie and headphones.
Thank you, everyone. I just, our second Spanish interpreter joined, so I need to take a moment to get her set up. So let me stop sharing. Truly.
Oh, in the
a
meantime,
proud-
if it's okay, I forgot to give a description, visual description. I'm a Mexican immigrant. I am light skinned. I have long dark hair with a gray streak, and I'm wearing a black t-shirt, and I have a white background with the logos of the orgs that I'm a co-founder of.
Wonderful. We're so happy for all of you to have all of you here. Okay. Okay, Martha, I think we got you set up for interpretation. Thank you, everyone. All right, so let's get started. All right, so I had shared some questions with our panelists earlier, and I'm actually going to drop them in the chat. But the first question is, how did you navigate accessing care? And okay, so I guess first, before we start, I want to give a little bit of context. So this panel is about disability justice and COVID-19, and this, the pandemic for the past 3 years has been a once in a lifetime, hopefully, oh my God, hopefully a once in a lifetime experience. And there have been a lot of issues that have come up, a lot of challenges that have arisen, and I think a lot of uncovering of the ways that our society feels a little bit like scotch tape together. And COVID sort of blew it up, and in some ways there's like a real potential for liberation there. And so I'm sorry, I'm also gathering my thoughts. I will also just say that I'm also a chronically sick and disabled person who is probably doing a little bit too much right now, but that's okay, because we're gonna figure this out and we're gonna get through this together. So I'm gonna start with the first question. For our panelists, how did you navigate accessing care and necessary resources early in the pandemic? And how did that shift from pre-pandemic? There's a second part to that. What were some of the challenges you faced in accessing that care? I'm gonna drop it in the chat. Does anyone feel compelled to start?
I'll use my Leo rising to get us.
Thank you, Leo Rising.
So for me, so how my kind of disabilities manifest are with chronic pain and fatigue and mobility instability, cognitive stuff, all the bits and the bods. And so it's kind of managing isn't super one directional, and it's really it's called like dynamic disability or episodic disability, because it's not, I don't have the same set of symptoms and the same intensity every day. And so kind of early in the pandemic, like early in the pandemic, I had already kind of been trying to navigate getting some help during the week with people that had cars, or setting up like weekly errand support things with people. I don't drive, so like taxis and things, the public transit was what I was doing. And live by myself. And so that was kind of like navigating those things. And so early in the pandemic, I already had a mask because I wear them anyway. And so that was like something that I was glad I didn't have to scurry for that immediately. It felt initially not that dissimilar from the rest of my life because I'm home all the time and have to think about how the air, the virus, what are happening in the air as soon as I go outside anyway. And so kind of accessing care at the beginning was kind of like pulling back and like watching like everyone who doesn't have to who hadn't had these kind of experiences before and be like really just like the concept of how we live as chronically ill people was so bizarre to the most of the able folks that we're talking about at the beginning of the pandemic. So it kind of felt like I went into it having the knowledge of what resources I needed in terms of like where to get stuff and how to get stuff and systems and things, but because of how the world responded to it and because of how like able-bodied people responded to it, my access to those things that I had like my systems for and like my, you know, whatever, all of those things, like the options just got smaller and smaller, and like it was weeks until I could get grocery deliveries. It was, I couldn't get my doctor's appointments, all my tests were postponed. And it's just been kind of like an emotional like heart wrench kind of from the get-go. Because as I'm sure we're all familiar, like day one we were told that we were the only ones that were going to get sick, so it didn't matter. And so I feel like that really shaped how care showed up around me because of how the perception of what I would need or not need or da da da. So, oh yeah, be there. Yeah.
Thanks, Pat.
Firstly, I want to acknowledge that I also forgot to do a visual description. So for those who would like it, I'm a Black femme individual with natural curly hair, wearing a black beanie and a blue shirt that says "When we fight, we win." In my background is my blinds, a leaf, and a few baubles. I would also like to acknowledge that a lot of messed up stuff is going to come up for us because we're reliving trauma by just cracking this egg. So I really just want to like make space for that and make space for folks to take care of themselves around that, because I was like, ooh, I feel the PTSD tinglies coming in. So and in taking care of myself, I would also like to take care of the rest of the folks in the room and just, you know, hold space for that. It was really funky for me because right before the pandemic started, I got my first grown-up job, which was with the government, doing disability work for the Office of Equity and Human Rights for the city of Portland. And it was a culture shock on so many levels because like I'm a broke cripple and like having a real job with real insurance and like no longer being on Social Security was not only like a class shift for me, but also like a power shift, because I had this very naive idea that, you know, as a community worker, as someone of the people coming into a governmental structure, that I would be able to make tangential change. That was really cute of me. That was very naive of me. And what I ultimately found was that like my skills as a community organizer were so foreign to people in our highest level of government who are making all of these policy decisions that affect us every day. Just my being in those rooms was really, really radical. And watching government employees kind of discover like, oh, you just do the thing. You just shut up and do the thing. You show up to people's houses with toilet paper and gloves and whatever the fuck they need, instead of waiting for 1,000 meetings and, you know, 3,000 different surveys saying that you need this percentage of green gloves that are small to medium sized. You just do it. You ask folks what they need and you bring it to them. And I feel like my struggle for the last 3 years has been trying to hammer those concepts into people's minds, is to trying to hammer that community care is the answer. The one thing that y'all keep avoiding is the answer. So early pandemic just looked like organizing. It looked like any sort of community mobilization that we have done for folks before. And I feel like we're still doing it. And at this point, we're still convincing folks that no, it's still happening. And the great gaslighting is still happening. And people don't want to say the G word, right? They don't want to recognize that we are in an active genocide. We're in several concurrent active genocides. And it's really daunting to be, I feel like we are the ones with the answers, and we have had the answers because we are the only ones who have cared about us and the only ones who show up for us. And yet people refuse to listen and run face first into their own oppression. Sorry, I think I got off on a little bit of a tangent, so I'll wind down.
No, thank you for that, Rue. And also thank you for just centering the ways that this ongoing experience is like extremely traumatic, and like every day there's something new, there's something else ever shifting. And so, yeah, I guess I do just want to say I really appreciate you all responding to this ask, because working adjacent to public health, the amount of ableism is like, I mean, it's pretty devastating. And so, yeah, but thank you for naming that. Joni or Gabriel?
Gabriel, do you want to go, or I can? Up to you.
Up to you. Why don't you go, and then I can transition us into the second question.
Okay, that sounds good. Everything that Patch and Rue have already said, I couldn't help but just nod my head, even though I'm having intense pain and I can't sit up right now because of it. I just as a FYI, I have some neurological issues. I'm kind of on the verge of getting some aphasia, which can mean that I'll start having trouble with word finding and speaking. And if it turns out that I am not able to speak, I'll answer in the chat box and I'll ask a host to read my answers out loud for me. So, you know, my life as a complex and chronically severely ill disabled person with physical disabilities did really not change a lot between pre-pandemic and pandemic times. I was already on my big learning curve on how to navigate life with these disabilities. And that already included mask wearing and isolation. So when other people started wearing masks, I was kind of like, oh, I don't feel like such a freak anymore. So I kind of enjoyed that, actually. But, you know, in a lot of ways, I also feel like I got to see others on the scale of populations basically go through what we had already been through. And just, I mean, I had to really kind of think back because I think I've blocked a lot of this from my memory. So I just wanted to take a quick moment to kind of describe the context of what was happening around that time, which will also help answer these questions from my perspective. And I really had to just think about and be reminded of it because so many things have developed and changed so quickly. So, you know, obviously the onset of COVID-19 in the US was a challenging time. Many folks were keeping abreast of the news in other countries and jumping on preprint research articles that had not gone through peer review. And there were quite a few folks that I knew that had passed away early in the pandemic. And although folks suspected COVID-19, like testing and access to testing wasn't there. And disability justice communities and patient forums, I was hearing about personal experiences on the ground regarding the inability to access care, patients that were not allowed access to their caregivers or to their interpreters. That actually happened to my family member. They don't speak English, but they would not allow anybody to be there with them while they were in the hospital severely ill. Homebound community members who had lost their caregivers and weren't able to find replacements. That's a huge thing that is still happening right now. Hostile interactions between immunocompromised folks asking others to wear masks around them, tensions in congregate housing between immunocompromised residents and then the staff that refused to vaccinate. And I had quite a lot of friends and community members whose procedures and surgeries were canceled, which, you know, was not a good thing because what that meant was potentially permanent damage that they couldn't come back from. And, you know, I was seeing the impact of disinformation in many communities and healthcare provider communities, particularly within alternative natural medicine wellness communities. I was hearing a lot of fear mongering and ableist and racist language and ideas being spewed forth that really, I mean, it was always there, but to see it all come out was unsettling. I mean, you know, we are like, you know, what's happening is eugenics. I knew many folks in a wide variety of places that were unable to purchase or even source soap, toilet paper, groceries, masks, and basic medical supplies like alcohol prep pads, hand sanitizer, disinfectant wipes, etc. And how many homebound folks were no longer able to access delivery services because they were so busy, they were also slammed. I mean, for probably 2 to 3 months, I had to stay up until 3 to 5 a.m. to try to place a grocery order because if I was lucky, that was really the only time a spot might open up. But, you know, in all of that, I also saw a lot of bright spots where folks were coming together to support one another with basic necessities. There are many community organization groups that were working independently and in parallel with one another. Neighborhood groups became really important for a lot of folks. And with respect to not being able to access sanitation supplies, we were really lucky in Multnomah County that Multnomah County Public Health basically they shifted one of their programs to basically create a program to get hand sanitizer and other sanitation supplies, especially to folks with disabilities. And, you know, the pandemic uncovered and magnified all of the pre-existing inequities within the system so that everyone, even those not part of marginalized and vulnerable populations living the life, could clearly see the disparate impacts on historically marginalized populations in terms of objective data, which, you know, was namely infection rates and death rates. And so for more folks being able to see the impacts of structural racism, that was a really big deal. And I mean, at the time, well, I am still part of the Multnomah County Public Health Advisory Board. Being a part of the board was very interesting because it really gave us a look into how a chronically underfunded public health organization was doing everything it could to reach folks by leveraging its community partnerships, which was a lot different than how regional hospital systems worked. It really showed the importance of building long-term relationships with communities, community capacity building, and how effective these relationships and interventions are in times of crisis. Like the importance of leveraging and mobilizing already existing relationships, I feel like can't be emphasized enough. Check. Gabriel, do you want
Okay. Yes. Thank you all for sharing your experiences so sincerely. I just like you, many of you, my life pre-pandemic was already a lot of staying home. I, you know, suffered from chronic fatigue, chronic pain. It fluctuates, but it's disabling at times. Many times I lost my ability to work to myalgic encephalomyelitis, but I have to say that it I benefited greatly from a previous pandemic, which was the HIV pandemic. That pandemic, thanks to the efforts of really brave organizers and groups like ACT UP, they left in place systems of care that I benefited greatly from. So I was able to access medical care because of HIV. I was able to access medications because of HIV. However, I was never able to access a competent provider for myalgic encephalomyelitis, which is really what took away my ability to work. That I had to pay for out of pocket to get a proper diagnosis. I have to pay out of pocket for the one medication that I take for it. At the time when the pandemic hit, I was receiving government assistance and food stamps, and rent assistance. So I was okay with the basics. And what changed, it's like it was expressed here, it was really hard to get deliveries. Like people started using the things that I used on a daily basis. And so it became harder. So the care that was really important to me and was to access information. I mean, information was so conflicting everywhere. It was so politicized, the fear mongering. So having community, being connected to folks who were organizing webinars like these, spaces where conversations were happening, where other disabled, queer and trans folks were included, was really important. It kept me afloat. The other thing is that when the lockdown happened, I was able to finish my graduate degree in social work because everything went online. I wasn't able to keep up with the program because it's a really intense ableist program. And I struggled through the first year, and I was definitely going to need a lot more accommodations and have to extend the program over a number of other years. And while they call that an accommodation, it was actually going to end up costing me more. So that's not an accommodation. So all these ableist things just kind of, when able-bodied folks have to care for themselves, all of a sudden it's like, oh no, you can do classes online. So it was like mixed feelings, but definitely some of the important care was provided by community, and it was connection. And so on that vein, the second question, if you don't mind, Esther, was about vaccination and access to vaccines. And I don't know if you want to read the whole question, and then I can just talk about a little bit of my experience as an immigrant.
Yeah,
And
absolutely.
information. Yeah.
Sure. Yeah. So the second question is sharing your experiences accessing the COVID-19 vaccine as a disabled person. Did you have hesitation or concern that the vaccine would create problems with existing health issues? And how did you decide whether you would or would not get vaccinated?
Thank you. So I was very concerned because activating the immune system is sort of a gamble for us with living with chronic illness and disabilities. And so I feel like I was reading as much as I could, trying to find out as much as I could. And then at the same time, trying to get the vaccine, and it was impossible. I could not get an appointment. What made me decide to get it in the end was that everyone, most of my dearest and closest friends are chronically ill and disabled. So I couldn't get sick and see them, for instance. And so my grandmother also is on dialysis. She's close to being 85. My mother and her siblings are all over 65. So in a way, I just thought for myself that it was a novel virus. We were all going to be exposed to it one way or another, either through vaccination or facing the virus itself. And I just, it seemed like the vaccination was the safest route because of the outcomes that so many of the folks, which were fatal, truly, of being exposed to the actual virus. So I decided to get vaccinated, and I benefited from, again, being in touch with service agencies, the HIV service agencies, one that is for Spanish speaking people. And they put me in contact with my own embassy. I'm a Mexican immigrant. And so the Mexican embassy has a program to connect Spanish speaking immigrants to healthcare services. It's called Ventanita de Salud. And I'm not sure if it's all over the US, but it was certainly in the Mexican consulate in New York. So maybe in the Mexican consulate in your city, they have a program that is similar, called Ventanita de Salud, like window to health. And they actually provided me with the Johnson & Johnson vaccine. And after I had it, then Europe stopped providing it because of the blood clot problems. I did get scared, but I'm okay. I'm grateful that I'm okay. And yeah, I'll yield to others, but that was sort of how I navigated getting vaccinated. It was mostly for others. I was really scared when I had to take my grandmother to get vaccinated because I kind of had to push her into it. And I was really scared that that would fall on me. But at the same time, if she got sick, I don't think she would have fared that well.
Thank you, Gabriel. Joni, Patch, or Ruth?
Thank you. And yeah, thanks for everything that you shared and the kind of perspectives that you brought to the decision-making process of getting the vaccine. So I felt very similarly hesitant, in large part because of the amount of disposability and misinformation I witnessed. And so I wasn't confident that we were being told what we would need to know about how it would affect chronically ill people and folks with already compromised immune systems. It was like there was still kind of like, you're not, it's a little sniffles, or like, oh, you're gonna, no problem, you'll be fine. But like already seeing like months and months of like, you don't care about those ones. And so it's like not feeling like we're getting like, we weren't getting all the information. So I was kind of like afraid of how I would respond, if I would have carrier, if I got really sick, with the response. And then the kind of like the, I guess as the numbers that we would need increase, that kind of, so it would kind of cycle again. So every time I was like, is this the right one, or is like, should I do it in this way, or should I wait till this gets done? Should I do that one first? Or like, you know, if I'm having this test, should I wait before that? If I'm having surgery, should I wait till after that? Like, and just kind of, I felt like in terms of like risk management, I think like I feel like the riskiest kind of like, okay, response for me was like, I guess I'm just gonna get this thing that I like trust because vaccines, but also like I've seen how the story has been told. So like I usually don't have, you know, like a lot of like anxieties about sources or effect or things like that about different like vaccines and stuff I've had in my lifetime. But this one I was like, I hope like that we're gonna be okay. Like I hope that like you know, that if we have reactions or different responses, that those are included in the data that, you know, gets kind of like shared. And yeah, I just felt like for me, just like getting it, same thing was like being safe around other people. Because I live alone, I have to hire everybody for everything. And so have a lot of, when I'm able to access care, just a lot of people that I don't live with, or like, but I don't see very often, like cycling in and out of my face. And so the more kind of protected I could um, like and reinforce kind of my immune system felt appealing. But um, I'm sure we'll talk about this too, but I think even now I'm still kind of, so I think of the pandemic in like TV seasons, because TV is one of my special interests. So like 20 to end of 20s, like season 1, and then we're in season 4 right now. um, and like season 2 is when the vaccine came. So yeah, like season 1, it was like everyone was like, okay, precautions, distance, like everything's virtual, hybrid. And it was like a moment of like somewhat collective, like, oh, we can do things differently. And then as soon as the whispers about season 2 vaccines started coming, it was like, or we could not. We just don't have to, because look, we'll just do this and we'll be fine. And yeah, and so just this kind of like, I haven't really felt, I've been trying to find the word, bear with me, trying to find the word for the space in between when a pendulum swings. Like I don't know what that's called, but I feel like very much like disabled folks and chronically ill folks are in that like void of we're acknowledging stuff, but we're not actually acknowledging stuff. But we see you, but we don't want to. And like, you know, and it's just like, oh, we will take your information or your resources or mutual aid. That was a great idea. Or what is that about fatigue? Like there is so much, but we're not actually being like included in the swing of how things are changing. And yeah, I feel like it was like a big risk and a big amount of trust for folks that already have immune system like complications to trust that the health information that we were getting was actually going to meet our needs.
Thanks, Patch. Joni or Ruth?
Go. I feel like I want to echo what everyone else said. I was like also very, very cautious. I think a lot of, I know for sure a lot of Black folks had a lot of reservations about like, what is the government putting in us this time? And it was interesting because I joined an organizing group of Black employees. And so we met like from all over the city, right? Different bureaus, different pay grades. So it was one of the only truly like intersectional groups meeting at the city. And the conversations that I had with those folks were some of the most transformative, because anytime you get a bunch of Negroes in a room working on one subject, like a lot of things get shifted, right? And so we were able to work through a lot of those collective anxieties that we had like as peoples in the public sphere in a more intimate way that was very directly connected to the work that we were doing out in the community. So anything that we had, any conclusions that we came to in this bubble and also our shared experiences, we then were able to dissipate out. And I feel like that was something I'm just now realizing was like a really, really powerful, like nebulous little thing that happened. And it was interesting because one of my coworkers like can't have the vaccine and still can't because of their medical complications. And so having them in the same room talking to folks who were at the time and very deeply anti-vax with all of the weird politics that come with that. And having us together in that room, like sharing those experiences and sharing those intersecting issues, I think helped me absolve a lot of that and helped me gain a more like intimate perspective, because I feel like, you know, when we're doing our research online and trying to talk to providers who don't necessarily have all of our keys and like have our best interest in minds, or like work our way through these systems that don't really care about us, it feels, at least for me and like my cognitive business, feels very difficult to be grounded to a reality and not have that that shared experience, like, you know, racially, ethnically, like locally, whatever, right? And so I feel like that gave me a lot of safety in having some sort of community where I could ask those questions. And I think that paired with, you know, having the online and like virtual disability community that I already had, really, again, those communities that have always been there for us, those families that have always been there for us really, really showed up. And I feel like, you know, alleviated a lot of my anxieties around trying to navigate this by myself. You know, I'm still on lockdown, you know, still not going out and still like being very, very highly cautious. It feels nice to still have those containers. So that's how I came to that decision. And I did get the vaccine, and I definitely had to fight with someone in their 20s holding a 6-inch thick binder, flipping through it, trying to tell me which booster shot that I needed, and ultimately telling me that I couldn't get a shot. That's maybe another story for another day, but the misinformation was rife.
Thanks,
Um,
Rue.
yeah, it's really nice hearing everyone's stories. Um, I yeah. So I guess my experience, well, first of all, there was a lot of disinformation. And, growing up here as a first generation immigrant, working with my family as a child, I've always had roles where I have helped to break down complex topics in order to make the information more accessible to others. Um, so I kind of automatically jumped in to kind of, fight the fight against disinformation by following the news probably way too closely, reading way too much research, and discussing this stuff with trusted folks, as well as a couple of my trusted providers on my healthcare team. And, I had already been thinking about this because previously I was working in pediatric hematology oncology. So the question of, do I get a flu shot or not, was like a really big deal for me um, at that time. And this is coming from decades of eschewing any kind of Western medicine or whatnot, and being pretty deep into the alternative medicine community. But the principles of community care and interdependence are values that I grew up with and were hammered into me. And those are also part of the 10 principles of disability justice. And so when I came into the decision, first of all, it's an individual decision. Everyone has to do their own risk benefit analysis using accurate factual information that hopefully has a person can understands. um i I also did not want to potentially get somebody that was more vulnerable sick, and I am also very high risk for COVID-19 complications. And there were no COVID-19 therapeutics that I could use due to anaphylaxis to excipients in all of them, except for one, remdesivir, which was actually not available anywhere for it for a patient that was outpatient. You had to be admitted into a hospital in order to access that. And, Oregon is 50th in the number of hospital beds to population size, which it's very lean, which can be considered to be a good thing, except not during crisis or pandemic situations. So there was a definite risk that I had to accept regarding the vaccine exacerbating my existing health issues. My immune system is very dysregulated. And I also have a primary immune deficiency. So there was a lot of stuff going on with all of that. And if I had to get intubated, that would probably kill me because I have neurological stuff going on with that structural part of my spine. So with respect to hesitations or concerns, I'm unfortunately a little bit more complicated than most in that we had strong suspicions that I had anaphylaxis to polysorbate 80 and PEG, which are in all of the vaccines that are available in the US. So what we tried to do, and I was really once I made the decision, I was really gung-ho about it. We tried to desensitize me to PEG, polyethylene glycol. I failed it 4 times. And the risk was that I ended up becoming more sensitized, which made me more reactive, not only to polysorbate 80 and PEG, but I started having anaphylaxis to basically many other ethoxylated chemicals. And so some of the barriers when you're a patient like that is like the clinics can't get the vaccines to administer them in clinic where it would be safer for me to get it. A patient can't get a prescription for the vaccine and then bring it to their doctor's office so that they can administer it there. Folks don't know what the rules are for how long the vaccine can be outside of refrigeration, because for me, a desensitization process would probably take 2 to 3 days, which would probably require at least 2 to 3 vaccines, which was kind of impossible to get at that point. And, you know, the rollout of the vaccines, in and of itself, like, so when they rolled out in Oregon, the regional hospital systems, which were like the major ones, OHSU, Providence, Legacy, were at the decision-making table, but it left out really important community organizations such as Virginia Garcia that serves mostly the Latina communities who are really getting hit hard with COVID-19. Like, all the research was showing that, all of the numbers was showing that. So having folks fall through the cracks, whether it's, you know, high-risk patients, elders in congregate housing that didn't have access to transportation to get a large group to the convention center to be vaccinated, much less have the wheelchairs in order to be able to do that, the long lines, the large distances a person has to traverse when you have a physical disability. And then also, like, homebound high-risk patients were unable to travel to get vaccinated as well. Anyway, so there are a lot of barriers. I will say, though, that I was able to talk directly to some teams at OHA, and bring some of these things up, and brings up some of the things that other people were sharing after I got permission to share those stories. And they did create a COVID-19 team to deal with and try to problem solve some of these things. So that was something that was really positive to see. But, you know, regardless, there was a lot of barriers. There's a lot of missteps that were taken.
Thank you, Joni. Thank you, everyone, for sharing. I want to do a time check. It's 7:01. So I think we should take a break, and we'll come back at 7:11. And then we do have one question in the Q&A, and then maybe we can try to answer like one more question that was sent for the Q&A. So thank you, everyone. Take the time you need, and we'll see you at 7:12 now. See you soon. We're just waiting on Patch. All right. So we have about 10 minutes left. We do have a Q&A question, so I'm gonna ask it now, and you all can read it in the Q&A section. It says, any advice for advocating for the safety of a parent of an autistic non-binary Black teen with 2 chronic health conditions who's having surgery at OHSU likely this spring or summer?
I'm not sure I understand the question.
Mhm.
I don't know if the person who wrote it would like to elaborate.
Yeah, let me see if I can find if Amy's here. Amy, if you're still here or you're listening, if you can elaborate on the question, you can put it in the Q&A. While we wait for Amy, I was wondering if the panelists had, so since I sent you the questions before, is there any specific question you'd be interested in answering? That I think that we have 3 left. I think there was a question on isolation ableism. There's a question about like, what was the best thing that came out of the pandemic for you? And then there's a question about like, what kind of messages do you have for people in power and those who are sort of doing advocacy? Oh, I see your hand, Patch.
So about the isolation piece, and I'm just moving around because of stretching and dogs. So with the isolation piece, I think it's been hard to even really be honest about how bad it is, because I feel like, especially because we're in season 4, like there's been so much energy around resetting, going back to 2019, let's have it back to where it was, etc., which wasn't. There was all the ableism, all the medical discrimination, medical racism and things beforehand, and then that's kind of been like amplified. And so like I don't know how other folks feel, but I definitely have a lot of isolation despair um, in at this point in it. And I've heard other folks talk about how, yeah, like pre-vaccine, pre-season 1, I felt like we were able to figure out outside hangs or like masked indoor things, or trying to find ways that we could connect, like um, that still felt in the realm of what we understood safety was. Um, and then the more leniency folks felt with the like magic of the vaccines and the misinformation that went along with that, um, the less that was available, the less that was invited. As we know, like almost all the hybrid and online virtual things were gone kind of by the end of 2021. And with uh, so in Canada, just a content warning for medical unaliving. Um, Canada has lots of problems that the world does not think we have. Um, Canada has a lot of problems that America doesn't think that we have. And one of our big issues right now is the legislation around medical assistance in dying and the ways that they've changed the criteria so that um, you can get access to that program quicker than you can get access to income, food banks, um, surgeries, therapy, everything. And it's being recommended to uh, a lot of chronic ill people that are just poor. And a lot of folks are accessing that program because they can't afford to exist in Canada anymore. And doctors are like, yeah, we're so yeah, I know that surgery, we're not gonna do that. But here I'm gonna recommend this, and people can get cleared for it in like days. Like it's not like, it's not like a months-long process. And so I think with the fact that that's been happening a lot, and the talk about that has been happening a lot, and there's enough people with similar symptoms, similar lifestyles, like to folks that I know, to myself, that are just not here anymore. And uh, they're the only people talking about it are other disabled people mostly, and so I feel like for me and for like other folks that like rely on folks, that have seen our circles of friends, people that we trust, like the people that we want to be vulnerable with, just get smaller and smaller. I feel like uh, I want folks that don't have this experience to really understand what they're communicating to us when they go to a resort, when they do whatever things that are have like contributed to the 3+ years that we've been in isolation. Um, and yeah, I think that like the conversation around, you know, uh, I had to go on vacation because my mental health. I had to go to this bar because like the artist that I really liked, and they only go on tour like every 6 months, and I missed the last 2. So just like for my mental health, it's just been really stressful. So I'm like, yeah, it's super stressful for everybody, and we all have different accesses and different resources to like tend to that. And yeah, I think that the kind of like invisibilizing of all of us that can't access that kind of mental health support, as if we're not also experiencing it, is a big like uh, care tension piece in the isolation, because the isolation I felt pre-pandemic was, ableism, racism, all the things, but I still had like a little uh, sliver of trust or something of relationship building. And now the effort to kind of like, well, what are your precautions, and how far are your precautions, and are you going to like do it all the time or just around when you think that I'm going to talk to you? And it's just like a lot of effort, and I don't have a lot of energy anyway, and I have a lot less energy to do the kind of like Tetris of safety. So yeah, I feel like I'm a lot more isolated than I was in 2020. I feel a lot less safe than I was in 2020. Um, and I feel less optimistic about getting care in my lifetime than I did in 2020.
Thank you, Patch. And I see that Joni added something in the chat, specifically saying a witness Canadian patients share about what you shared about, and they aren't able to access treatment, but they were able to get into that program. So it's pretty, I mean, I just think if anyone is in denial about the ways that disabled folks are really dehumanized in this whole, I mean, just generally, but the ways that it's been like so incredibly intense, it's very real. And it's horrifying.
Yeah. And I wanted to echo the sentiment that isolation and feeling of unsafety is feeling unsafe is greater now, I think, because of how so many people have just moved on while thousands of people still die a month. That to me, well, that I think still a crisis. And this is a mass disabling event. I mean, people don't realize that long COVID can actually disable them. And so every COVID infection can result in long COVID. And a lot of people are just dismissing that. And, you know, we have a whole new swath of people who are now chronically ill and disabled thanks to COVID. Thousands of people still dying a month. And people want to go back to what life was like. I don't want to go back to what life was like. It wasn't great. And it's even worse now. So we are placed in the position of being the killjoys by having to ask people to mask, by having to ask people to make their events accessible. Again, you know, there was a window of hope, and now it's sort of going backwards. And yes, with our energy challenges, we still are placed in the position of having to demand these things that were all of a sudden freely sort of implemented, and now they're being taken away. So check.
Thanks, Gabriel. I do wanna, I think Amy edited her question slightly, so it's changed to any advice for advocating for the safety of a parent of an autistic, non-binary Black teen with 2 chronic health conditions who's having surgery at OHSU likely this spring or summer. So I think it's about navigating or negotiating boundaries around care, or the like what, you know, how to navigate that. And I know we don't have very much time, but any thoughts?
Does Oregon still have mask mandates in medical settings? Because in New York, it was just lifted. And that is one of the first things that is really hard to advocate for. Like, how do you ask a medical provider, please put a mask on?
I believe we still have in medical settings, but it's not like a universal mask mandate. I mean, honestly, like my first instinct is like, I'm worried about the kid. Seems to be the one with the intersecting identities that are most vulnerable, right? So I'm worried about the safety of the child in that scenario, and like losing an important like safety figure, or like having that really big shift and change for them. I know with my neurospicy brain, I don't like change, and like for someone, I don't know what this person's like specific needs or triggers or whatever are, but my first instinct is to like, y'all need a team. You can't do anything alone. And so like the more people you have around you that can help you advocate, because you can't just be one person, because as we all know, like being a cripple is a full-time job. It's 3 full-time jobs, and we all could use a secretary, right? And like navigating bureaucracy is like this system of like wearing you down, death by 1,000 cuts, just like hoping that you get tired and just die sort of thing. So having someone there who can be a squeaky wheel and advocate for whatever the parent or the child needs, right? Because this is a family unit. We're not like, you can't just parcel people out and like unimbue their needs from each other. So yeah, my first instinct is to have a team, have some sort of like family. It's rough because, you know, as someone who's like trying to escape their work in government right now, because I don't want to be a part of the genocide machine, I've had to be like a disability doula, because my name is like one of the names that pops up when you search disability. I've had to just like answer the phone and be like, welcome people into disability, right? Like I'm a first point of contact, and I have to be the one that bears the news that there is nothing, no one is coming to save us. So you have to find people who understand your risks, who understand where you are, in life and who are willing to be your ride or die. And like speaking to the piece about isolation, like we found out who our ride or dies were. That's what I got out of the pandemic. I found out who wanted their social justice cookies and their little gold star, and who was in it to win it and would actually risk their lives to make sure that I stayed alive, you know, or to make sure that we could mutually stay alive, right? Like people who were willing to put their privilege on the line and put their necks out for us. Like that's what I got out of the pandemic. And that's what we're going to need to continue through whatever the future may bring. Because like, it would be nice if this was a once in a lifetime thing, as you said, when we kind of opened up, but I'm just like, we didn't stop any of the things that caused the first one. So we're due for another one any day. And it's really, that's a really stark reality. And to rely on our resilience, like I'm really resentful of the term resilience at this point, because like, I feel like a fruit leather in the sun. There's nothing left. Like we're beef jerky, we're dust, like, and I'm just hoping that my dust is the grain of sand that wears down the machine. And I'm like, thank you also, Gabriel, for bringing up the fact that we've lived through 2 pandemics as queers. Like my uncle was diagnosed with HIV in like 87, I think, and he's still kicking. And like the fact that he's managed to be an elder, right? Because he's in his like late 60s now. Like the fact that he managed to be an elder, I think is a testament, and is one of the things that keeps me going. He also used to work at a different light bookstore. So he like was my link to everything Black and queer and different. So I think that like reading and remembering that like our ancestors have been through so much, and like we are on their shoulders and they are with us. Like we have Crip ancestors, like Harriet Tubman was a Crip, right? Like all of our favorites have been like Crips throughout history. And like we are our only hope, I feel like, to try to end on a more positive, less doomy note. What I've really gotten out of the pandemic is like, okay, I know who the team is, right? We know who the A team is. I know like who I need to go to in community for what. I know who the real movers and shakers are. And I could not give less of a shit about anybody else, to be frank. Excuse my French, but the time is over. Like, especially as like a facilitator, someone who's been working in DEI for so very long, no one's getting the benefit of the doubt anymore. We're done. Like, you either do your reading, you want to do your homework, you're curious about how to do better, or you're in the way. And that's it. Like, I don't have time. I could stop getting insulin any day. Like, we know now because of supply chain stuff, the second one of our medications goes out, that's it for us. So we know the meaning of like work until you die. Like we don't have a choice because our survival is wrapped up in it. I don't have anything better to do than to fight for my own survival. I don't know what everyone else is doing. Y'all are really cute out here going to concerts and screaming about Beyonce and whatnot, but I love Queen Mother, but she ain't worth it. All right, I'll shut myself up because I feel another rant coming on, but thank y'all.
I wanted to just, sorry, before to build on what you offered about the kid in that scenario. I think like if folks don't know that, you know, I don't know if it's the same in the States, but I think so, that if you're in an appointment and you ask a thing and they refuse the thing, you can ask them to put that refusal on your chart, so it's written down. And also if folks are comfortable recording their appointments, letting the people know that they're recording their appointments, saying, I have cognitive stuff, I can't remember what you're going to say, so I'm going to put on my recording. Try to record as much as you can that you feel comfortable with, because I have had experiences in hospital in the pandemic of just info going missing, test results going missing, people going back on their word when they're not in front of you, kind of stuff. And that's just like, you're already going to have stress, and like your kid's already going to have stress. And so yeah, like having your team, having folks that are going to do the recording for you, or they're going to be like, oh, actually that's not what they, you know, have someone that's going to help you, like give you what you need to be the best advocate for that kid.
This is Joni. This is also in regards to Amy's question. Is there a physician or a provider of some kind at OHSU that is a trustworthy advocate and has the best interests of you and your family in mind? Because that will go a long way if there's somebody on the inside saying, hey, these people are cool, and etc. That could be really helpful.
Yeah, thanks everyone, and thanks for such great feedback. Amy says there is a team through the gender clinic supporting them, but I don't know how involved they'll be. Yeah, I mean, I think even just sort of like going through your own like contacts of who who may not be on that team but knows someone who knows someone. Like when I was like, oh, I think I know like 4 people at OHSU who I don't know or if they're connected to the gender clinic, but they could be helpful, right? So we are right at 7:30. Thank you everyone for being here. And just to wrap up, for those who are joining as participants or as attendees, we have a feedback form. I'm going to just drop the link in there if you can fill that out for us. And just wanted to thank you, the panelists, for being here and for sharing your experiences. And I apologize for misspeaking. I think I was really just kind of jump off the cuff and I totally misspoke. So I apologize, especially about the once in a lifetime pandemic. It's just a glib sort of like anxious, but also no excuses. But yeah, thinking about that. And then also,
It's a valid hope.
I know, gosh. And is it also denial? Sometimes I'm like fighting with myself about my own denial about the world.
So speaking to your own lifetime, because not everyone in here is a queer elder.
Let's hope and pray that we all get to the queer elder status. I'm not sure if, there's Patch. I think if folks have any things they want to share or links or work you're doing before we wrap up, and then also just sharing so I want to offer some space for that if anyone has anything they want to share.
I just want to share one thing that relates to what's the best thing that came out of the pandemic for you. For me, obviously, deeper relationships with other disabled folks who center disability justice in their lives and organizing with folks to lift up and support our communities, but also I got to see the power and the real impact of what listening, cooperation, and organizing with others can do and what impact they have. And I'm specifically speaking about Oregon Crisis Care Guidelines, which me and 2 other folks, Alicia Makesa and Dr. Ryan Pettyway, wrote an editorial in the Oregonian about what we were witnessing and very concerned about in these meetings that were basically deliberating on what the crisis care guidelines should be and look like without including community participation. From that, it trickled down to OHA putting out guidance that was much more along the lines of equity and creating a resource allocation committee to invite community members to work on basically creating new crisis care guidelines. So I'm just sharing that as an example of something that's happening right now, something that has come out of organizing during the pandemic, that at least there's something that's happening that's really important.
Thanks, Joni. Thanks for sharing that. Patch, I think you had gone off mute for a second.
Yeah, I wanted to share, just thank you for collecting these wonderful folks that we could share together. Anytime that I've had the opportunity to just like be on a screen or be on a Zoom or something with other disabled folks in the past 3 seasons of life has been nourishing. And so I just thank you for all of your time and existences and work. And I wanted to share that I have a book coming out in April. I have my first poetry collection, Remedies for Chiron, is coming out April 14th. And I have the, so that's the Amazon link, but it's like available at your own like different stores, but that's like the link for the information. Yeah, there's a lot of stuff about disability and sadness and bodies and gay things, gay sexy things. And yeah, I'll be thinking about you past today. So thanks.
Thank you, Pat. And then Gabriel, I see that you shared a link to the long COVID justice. org
Yes,
you
there
work
are
with.
resources, and some of the groups that we work with also are connected to the website. So if you peruse the website, you can get some resources, especially if you're living with long COVID or associated diseases, which are so many. So
Yeah, thank you. Thank you all so much. Well, I think that's the end. So we appreciate you all. Have a good night and take good care. We'll see you soon. Bye, everyone.
thank you.
Thanks, everyone.
Gracias.
Thank you so much.